everyone. Welcome to today's program. We're here today with Dr. Ekta Sharma. Dr. Sharma, welcome.
Thank you.
I have the best job in the world because I get to meet personally some of the best doctors in the world. Dr. Sharma is very passionate and very caring. Dr. Sharma, tell us a little bit about yourself and your practice.
Well, I'm a private practice owner, so I'm a sole physician in a private practice in Diamond Bar, California. And I'm contracted with Allied Pacific, which is where I got this opportunity to speak to you. So I'm really thankful. Thank you so much for having me.
Oh, we're happy to have you. So tell us a little bit about your experience and why it's important to have a relationship with their own personal physician.
I think it's really important to feel comfortable with your physician. So my focus is to basically be patient-oriented. My practice is all about being patient-centered. Oh. So I welcome you into my practice like as if I'm welcoming you into my house. It's like the old-time family physician.
It's old school. That's old school doctors, right?
It is. Right? It is. Because I want to keep it simple. I want to keep it close and intimate. I want to know you. I want to know your lifestyle. I want to know how you live, so you feel comfortable enough to share everything with me. And once I know you and I feel comfortable enough with you and you feel comfortable enough with me, and then I use your labs to kind of help me diagnose what's there and what's not.
So you really know your patients. You don't just see your patients, you really know your patients, is that?
Yes.
What Dr. Sharma is saying is that you need to have this kind of relationship where you can be talking, not just going through the motions. And I think that's something that you're stressing in your practice.
Right. So when you come see me, I really, I'm not kidding, want to know what is your medical history. And I kind of get you to think. People say, oh, I had a little high cholesterol at one point, I had this, I have that. And I say, okay, well, I'm glad you told me all this. Let's do your labs. Because I want to see what's going on inside now, so I get a baseline. And I usually send you to the lab. The labs come back to me. I meet with you again, and I do what I'm supposed to do, which is explain the labs to you. And 9 out of 10 times, I have found people have high cholesterol. They have prediabetes. They have diabetes. They have low vitamin D. And they're looking at me like, no, my doctor said I was perfect. And that's when I say, you know, yes, you are, but I want to keep you that way. So let's go over your labs, and I want you to understand them. So here's the normal, here's the abnormal, and this is the range. Do you understand? And so I see that you have prediabetes. So let's talk about that. So I need to help them now. So the medications help me get you there sooner, so you don't have those complications tomorrow. You don't have a stroke, you don't have a heart attack, we control your blood pressure, we control your sugar. But once you get to the right spot with the medication, we're fixing your lifestyle to a point that you get to where I can start taking the medications off. The point is not, patients often ask me, I can get off the medications, and I say yes. If you really wanted to, there's some diseases, yes. You
were telling me a little story. Before we went on the air, Dr. Sharma was telling me a story about a situation with a patient. Tell our viewers a little about what happened.
As I mentioned to you, when I saw this patient, I saw him 2 or 3 times, and I had asked him to do with his labs and then come in after he's done his labs. Once he came to me, I went over the labs as I always do with everyone. So once I saw him, I said, you have diabetes, sir. I didn't know this. Did you know this? And he's like, no, I didn't know this. Is this something that's serious? Like, am I going to die? And I said, no, absolutely not. Yes, you have diabetes, but I'm going to show you how to live with this. And it's not the end of the world. You're going to see how easy it is, how simple it is, because I'm going to sit here and guide you through it. So what I do is I take a minute and I say, listen, from now on, you're going to see me every week, and I'm going to teach you how to eat and how we're going to improve. So I tell them, go to the gym, just walk for 5 minutes and then come back. First, we develop a habit.
Just 5 minutes?
Just 5 minutes. I just want you to get used to going there. And a month passes by, your sugars have improved, you've started going to the gym, and he himself felt so comfortable, he wasn't scared anymore.
Right.
And so we fixed it, and you're not on, and he didn't go on any medication. Nothing. His sugar came down all on its own. And he was so happy, and he was no longer scared.
I suspect his previous doctor was afraid to give bad news, but you turned the bad situation into a good situation anyway.
That's the goal.
So you can hear in Dr. Sharma's voice the passion. This is not your typical doctor. Now, if our viewers would like to contact you, do you have a phone number you could give out for the viewers?
Absolutely. Thank you. Thank you for this opportunity again.
Sure.
My phone number at my office is 909-839-0808.
Thank you very much for joining. We hope you come back again. We hope you enjoyed it and that you'll join us again.
It was such a pleasure. Thank you, Trevor. I really appreciate it.
All right. Well, thank you all for joining us. Bye-bye.